Hey y'all, it's Ashley, physical therapist with TravelTrim Corporate Wellness. I am here with Dr. Joseph Schaffer. Dr. Schaffer is an orthopedic surgeon. Let me see if I can get this right. You're a sports medicine doctor, orthopedic surgeon.
Yes.
It's a residency in sports medicine, fellowship in orthopedic surgery, or did I get that backwards?
The other way around. So
Okay.
Residency in orthopedic surgery,
Okay.
fellowship in orthopedic sports medicine.
Lots of school.
Yes, so much school. So yeah, I'm a board certified orthopedic surgeon.
Okay.
And my fellowship specialty training is in sports medicine. So it means we specialize in treatment of sort of soft tissue disorders, tendons, cartilage injuries around the shoulder, the knee, other joints as well. But I've got a particular interest in the shoulder.
Wonderful, which is great because that's what we're going to talk about today. Dr. Schaffer practices in Nashville, Tennessee with the Houston Clinic. Houston Orthopedics, I think it's the full name.
Yes, Houston Clinic Orthopedics.
Yes. And we're going to talk about the shoulder. And so I have some questions for him, and here we go. I would love to know what is the prevalence and frequency of shoulder pain in adults? Now, I'm not talking about throwing athletes. I'm talking about just the average human.
All comers.
Correct.
Good question. Shoulder problems are incredibly common in adults. So the lifetime prevalence of meaning, like, what are the odds that somebody's going to have shoulder pain at some point in their life? It's actually 70%.
Okay.
So more likely than not, you will have shoulder pain at some point in your life, and that's can be any degree of severity, but it generally will be more common as you age. So in terms of some of the risk factors there, but yeah, absolutely, at some point in your life, 70%.
That is pretty frequent.
Mm-hmm.
And what are the most common diagnoses that you see pertaining to the shoulder?
Sure, absolutely. So in the shoulder, most common problems are related to the rotator cuff in some way. So the rotator cuff, what is the rotator cuff? It's a group of tendons that surround the shoulder joint and help control the motion and provide stability to the shoulder joint. So the range of problems that can occur with the rotator cuff is broad. It's sort of a spectrum of disorders, and it can go from degenerative problems that occur over time, sort of wear and tear of the rotator cuff tendons, to
arthritic changes, like
arthritic
degenerative
changes as well. Yeah, arthritis is a degenerative condition, so that's a good example. Yeah. But the rotator cuff itself, just like the joint cartilage in arthritis, can also sort of wear out over time. There's a number of reasons that can happen in terms of what we call impingement, and we can talk about that more if you like. But the other type of things that can happen is an acute injury, what we call basically some kind of trauma, some kind of injury to the shoulder where either maybe you're lifting something heavy and felt a pop, or you had a fall and actually had an event that caused an injury to your shoulder.
Okay, what's the most common mechanism for a rotator cuff tear in an adult?
So sure. So I think that for an adult in their 40s or 50s, it's more likely to be a degenerative tear. So that tendon has probably weakened over time, and then maybe you had something that happened where you were lifting above your head or something like that, and you felt a pull. And then the tear kind of gives away from the bone. So it's what we call an avulsion mechanism. The tendon kind of pulls off the bone where it attaches at the humerus, which is the arm bone.
Okay.
But otherwise, if you were, say, a young person, it might be more of a high energy trauma, like a fall from a height, like from a ladder, or even a motor vehicle collision, something like that.
Okay. And I just want to clarify, it's rotator cuff, not rotary cup.
That's true, although
we know
if the rotor cuff is injured, I also know what it means. Yeah.
I just wanted to clarify.
The rotator cuff.
Rotator cuff.
Yes.
And just a little bit more anatomy. The tendons are all attached to muscles, which sit on the shoulder blade, correct?
Yes, yeah,
okay.
So the shoulder blade or the scapula is where the muscles are all attached.
Okay.
And then those muscles become tendons as they get to the ball and socket joint.
Okay.
And those tendons kind of all come together in what we call the rotator cuff.
Got it. Mm-hmm. And I mentioned that just because when we start talking about potential preventative measures, we'll talk about strengthening. So I want to make sure that you guys know that the rotator cuff has a lot to do with the muscles as well.
Yes, the muscles and tendons, absolutely.
And then how common are fractures of the shoulder?
Fractures of the shoulder are also relatively common. Again, as we age, as bones become weaker, a lower energy fracture is more likely to occur, and that might be from a fall, onto an outstretched arm.
Right.
And you can actually get a fracture just below the shoulder or around. And the humerus is called a proximal humeral fracture. That's actually considered a fragility fracture.
Okay.
So just like if an elderly person breaks their hip, that's also considered a fragility fracture. It might be a sign of osteoporosis.
Okay.
So that's an important thing to consider. And,
Okay.
Yeah, that's another preventative thing that can be talked about is maintaining bone health.
Wonderful.
Mm-hmm.
Well, I actually had a question about that. So, since we're on the subject, what nutritional advice would you have for bone health, joint health?
Sure.
To try to maybe prevent some of these degenerative changes.
Yeah, well, for bone health in general, we want to maintain the density and the strength of the bones over time. As we age, naturally the bones lose strength. They lose the density of the calcium that's in the bones, and that can be prevented to some degree, at least, through proper nutrition. So we've heard about calcium and vitamin D.
Right.
So calcium is important, of course, because that's the major component of the bone. Your body needs that to continually build the bone. And vitamin D is an important vitamin that your body needs in order to build the bone. It's a part of the chemistry. With our modern lifestyles, we don't see the sun as much as we used to. And the sun is actually really important for your body's ability to create vitamin D on its own. Without that, you have to take vitamin D in either through your diet or through supplements.
Okay.
And the truth is, most of us don't get enough vitamin D in our diet, and we really ought to be taking supplements. In fact, I would say probably every adult in America should be taking vitamin D and calcium. It's particularly important for women, and particularly important for women as they approach and even after menopause, because that's when their bone health really starts to deteriorate.
Right.
But we have specific recommendations. Even we say you should take 2,000 units of vitamin D daily, at least. You could take more safely, and 1,200 milligrams of calcium.
Okay.
So that's sort of a general baseline goal. At different points in your life, you may need more, but I'd say talk to your doctor about what specifically you may need.
Okay. And they can look at your blood chemistry, do a bone density scan.
Exactly.
Okay.
Yeah, so your doctor will be able to check your vitamin D level and see if you have a deficiency. Again, probably more people do than you might expect. If you do have a deficiency, then you probably need more vitamin D supplements than just that 2,000 units a day. The bone density scans are not something that young people have to get, but at a certain age, you might start routinely getting those. And that will look at the bone density of actually your hips and your spine.
Right.
And from that, you can get a good picture of how dense your bones are, and if you've progressed to a point where maybe you need other treatments to help prevent those fractures.
Got it.
Mm-hmm.
So we want to prevent the fragility fractures.
Much better to prevent than to treat once they've been broken.
Much easier.
Yes.
Okay. Let's get back to the shoulder a little bit.
Okay.
In the patients that you've seen with shoulder pain and injuries, are there any commonalities? And you said age, the older you get, the more frequent it becomes.
Sure.
Are there any other commonalities, vocations or body composition or any other commonalities?
So risk factors for rotator cuff problems, for example, one is definitely smoking. Smoking is such a common risk factor for so many conditions, and orthopedic problems are included. Another thing that can contribute is diabetes, actually. Diabetes is a risk factor for shoulder problems and shoulder pain, and including other conditions like frozen shoulders and things like that are all very common with diabetes.
Type 2?
Type 2.
Okay.
And honestly, type 1 as well.
Okay.
For certain conditions. And then In terms of other shoulder problems, obesity is actually definitely a risk factor for rotator cuff tears. And then in terms of vocation, you asked about. So certainly one of the thoughts is that repetitive overhead activity contributes to wear and tear of the rotator cuff over time. So some of those jobs that do involve repetitive overhead lifting or other activity can definitely contribute to those issues.
Okay. I didn't know about the obesity and rotator cuff tear.
It is. It's yes. We know, as obesity becomes more and more of an issue in America, there's more research going into it, and it's definitely been associated with rotator cuff tears, and even particularly large rotator cuff tears,
which surgically have poor outcomes.
Unfortunately, yes.
Okay. Just a side note there. Yeah. What about posture? Do you feel like posture is important in preventing shoulder pain? I know, as I sit up straight.
Yeah. So yeah, absolutely, great question. Posture plays a huge role in or not just rotator cuff problems, shoulder pain in general. We talked about anatomy for a second before. Right. So the rotator cuff can have a problem called impingement, where when you raise your arm up, the bones can kind of bump into each other. The arm bone can bump into the sort of bony prominences of the shoulder blade around your shoulder otherwise. So you can feel the acromion up top. Right. That's one part of the shoulder blade. There's actually a little bony bump in the front that you might be able to feel called the coracoid. And as you move your arm through space, those things can bump into each other. You might imagine if you have poor posture of your shoulder blade, or if hunched forward and over, now you can't raise up as easily without impinging.
Right. If you're watching this, try it. Slouch and try to raise your arm, and then sit up and try to raise your arm. It's a good test.
Yeah, it's a great test. It's much easier. It's a really good illustration to show how that affects things. Think straight posture and bringing your shoulder blades back and down together makes a huge difference in just the range of motion you have before you impinge, but also the ability of the muscles around the shoulder to coordinate and control the motion.
Great. And as we spend more time on computers and devices, I'm assuming that this is contributing to
absolutely
more patient visits for you.
We're all guilty of it.
Well,
I spend too much of my time at computers as well, and there's a tendency to hunch. So I think posture awareness is very important. Adjusting our posture constantly to try to prevent that.
So one of the things I like to say is ears over shoulders, shoulders over hips, and it just helps. When you say straight spine, somehow people start arching backwards. Yeah, but that's just one of my cues for my patients.
That's great. Yeah, I always tell myself I'm trying to get my head as high up off the seat as I can.
Ooh, I like that too.
Imagine like a string pulling my head up, to the ceiling.
The plumb line. My mom used to say that.
Yeah.
A plumb line pulling your head up. She also used to make me put a book on my head and walk up and down the stairs, but that was back in the day. What tips and suggestions outside of what we talked about with nutrition and obviously posture do you recommend for avoiding shoulder problems?
Yeah, good question. So I think that maintaining the posture like we talked about is very helpful. Just maintaining generally the strength, the mobility, and the coordination of your shoulders will help prevent injury. Oftentimes with young people, I'll see people get injuries lifting weights. They're very strong. Overall they have big muscles, but their rotator cuff muscles may not be well enough trained to keep up with what they're asking their body to do otherwise. So there are specific exercises you can do for it, and you actually can do this under the guidance of a skilled therapist. But there's a lot of good resources online now too for learning an exercise program for the rotator cuff. And I'll explain for patients oftentimes that these exercises usually focus on endurance and coordination rather than power. The rotator cuff muscles are not huge; they're relatively small muscles, but they're very important for the stability. And because of that, the exercises tend to focus on sort of higher repetitions, lower resistance, lower weight than you might see with like powerlifting, for example.
So not like bench presses. We're talking
not bench presses, but there's a lot of exercises with bands and cables, and and sometimes people actually even rows with the elbows down by the side, puts the shoulder in a somewhat more stable position, but the rotator cuff is engaged and firing during that lift. So there are certain specific exercises that are very helpful. And I think it's important to remember they are specific exercises, because sometimes I'll meet patients who say, I'm really active all the time. My job is very demanding. I use my shoulders all the time, but it's not just using them generally in your everyday life. It is a specific focus in terms of maintaining that strength and endurance of the rotator cuff.
And let's touch on age really quickly.
Sure.
At the older we get, the more challenging it is to, let's say, increase cellular metabolism slows down, which means we're not going to be, it's easier to lose strength and easier to have poor habits musculoskeletally quicker.
Absolutely.
So the older we get, the more important it is to actually strengthen these muscles.
It definitely takes more of a focused effort.
Okay.
And I think it's easier to maintain what you have than to try to gain it back later. So maintaining a healthy, active lifestyle throughout life, I think, is the best way. It's easier to prevent than to cure.
Maintain. That was a word I couldn't think of in my brain, but yes. So,
absolutely.
Even if you have a demanding job,
Mm-hmm.
if it requires lots of sitting, working at a computer, or lots of repetitive movement with the arm, you're going to be better suited to have a specific strengthening program to prevent problems.
Yeah, and I should say it's not just strengthening too, as you probably know yourself, the motion of the shoulder, just the mobility, the range of motion is very important to maintaining proper mechanics of the shoulder joint. So a little bit of stiffness, which you might not actually notice unless you're specifically looking for it, measuring it, can actually subtly affect the mechanics of the shoulder joint as the ball and socket moves around, and that can lead to injury. So stretching exercises are also very important.
Wonderful. I need to remember that too. I'm good at lifting weights, not so good at stretching out. Apart from trauma, what do you recommend as like the best course of action for someone complaining of shoulder pain? They woke up, their shoulder bothered them, it's just not going away.
Sure.
You're not afraid of a fracture or a major rotator cuff tear. What would you recommend?
Right. So you didn't have an injury. You're not worried that something terrible has happened.
Right.
Then at that point you probably have perhaps like some impingement, like we were talking about, or perhaps you have some early degenerative change otherwise, like arthritis.
Right.
And those sort of things tend to occur over time, but maybe one day you start noticing the pain. That's not an emergency, like you pointed out. So you can probably start managing it yourself on your own without having to come to the orthopedic surgeon, for example. I'm always happy to see you, but you probably don't need me initially. I think that it's very reasonable to take some anti-inflammatory medicine, over the counter, ibuprofen or naproxen. Tylenol, I always like to point out, is not an anti-inflammatory medicine. If you're having pain that's not controlled by ibuprofen or naproxen, or you have maybe a medical condition that prevents you from being able to take those anti-inflammatory medicines, Tylenol is a good option. A lot of people don't like to take medicines. I don't like to take pills, and I certainly understand that.
Right.
But I think that this is not starting a medicine you're going to have to take the rest of your life. This is just getting you through this short time. And the anti-inflammatory medicines are not just masking the pain; they're actually treating the underlying inflammation.
Right.
And when the pain and the inflammation is improved, your shoulder function, your shoulder motion can get back to normal. So you're not having the recurrent irritation of it.
Compensating and then continuing the cycle.
Yeah, absolutely. And those home exercise programs we mentioned, you can look those up at that point. You can start working on some things on your own too, and that can go a long way also.
When do you recommend people go get imaging of their shoulder? Because honestly, our culture, they feel pain, they think I need x-rays or an MRI to know what's going on. When do you recommend people get imaging?
Well, that's a good question. It's complicated because I think it when somebody comes to see a medical professional like myself, they're going to get an evaluation otherwise as well. So I'm going to be doing a physical exam. I'm going to be talking with them, and I'll have a sense based on my experience and training as to whether or not we need imaging at that point. That being said, oftentimes we do get X-rays fairly early because they're simple to get, and they're quick, they're simple, and they help us rule out problems that we do need to know about, which thankfully are going to be rare. Like, I may not expect a fracture, but sometimes you find one that you didn't expect, and it's important to know about it then. And they also can show us things like arthritis. Now, I think that by the time a patient reaches me, they've had symptoms for a while. There is a reason that we need to get those X-rays to rule it out. Now, everybody that has shoulder pain doesn't need an X-ray, and I would say that you probably need to get evaluated by either at least your primary care doctor, if not your orthopedic surgeon. If you've had pain for maybe more than a month,
okay.
If you're having pain that's severe enough that it's just interfering with the simplest of everyday activities, or if it's waking you up at night, for example, that's a warning sign that something more serious, or at least more severe, is going on. I think it's time to seek evaluation.
Now, with the shoulder, if it's bothering you, you're going to try to take care of it on your own. You've taken the over-the-counter anti-inflammatories. Should you avoid what hurts, or should you maintain daily activity?
That's a great point. I should have even mentioned that in the first place. So, resting, absolutely. A little rest goes a long way.
Okay.
So yeah, avoid the re-aggravation of it, and then once you're feeling better, ease your way back into it if you can. Now, of course, sometimes people feel like they can't avoid things in their job, but they may be able to even change just the ergonomics of what they're doing.
Right.
And that can prevent the re-injury. Yeah, this is not a no pain, no gain situation.
Right.
This is something where you want to avoid the re-irritation or re-aggravation of whatever's going on, and then ease your way back into normal activities once you've let things settle down.
And then let's say you rest, relative rest. You have to live, but relative rest for a week or so. If pain's not going away, but you're avoiding the aggravating condition, that's when you might want to start thinking about asking your primary care provider, or do I go see an orthopedic surgeon, or ask your physical therapist?
Absolutely. And sometimes you can have a more serious problem that didn't necessarily have an injury event.
Right.
We talked about the degenerative rotator cuff tears. Those occur without necessarily feeling something happen in your shoulder. And if you do have a rotator cuff tear, especially as it becomes bigger, that's something that you don't necessarily want to just wait on. That's something that probably will get worse over time unless it's treated. So it is best to to use your judgment, but ignoring problems is not good either.
Got it.
Better to get to it early.
I agree. When should someone come see you without that waiting? Without the let me see if I can treat this for myself. What are some red flags that say I need to go see an orthopedic surgeon for this?
Yeah, I think a major traumatic event, absolutely. I mean, you might even go into the emergency department for that. I think if you felt something pop, or you're feeling ongoing like mechanical symptoms in your shoulder that are new and that are painful, then that's important. But when I say mechanical symptoms, that means basically you're feeling popping or crunching in your shoulder. A lot of people have that, by the way, and that's not necessarily something that you have to worry about if it's not hurting you. But when it's associated with pain, it might be a problem. If you have a lot of new bruising around the shoulder, that might be a sign that there's a broken bone or some other major injury. If you have deformity around your shoulder, so sometimes people make it a biceps tendon rupture, and they actually now have what's called a Popeye deformity. Yeah, and that's something that you might want to know about sooner rather than later.
Right.
If you are going to treat that surgically, for example, you would need to do that as soon as possible. I think that if you're having severe pain that's waking you, again, waking at night is definitely a warning sign, or something that you can't control with medications on your own over the counter. I think you need to get evaluated as well.
What about like weakness?
Yeah.
Like I can't raise my arm.
Yeah, great point. So if you're having weakness, that might be a sign that there's major tendon injury too. So sometimes it can be so severe that people can't raise it at all. They just literally can't get it above here. And that might be a sign that there's a very large rotator cuff tear that again, should be treated as soon as possible, because if it's not, it could get to the point where you actually literally can't fix it even with surgery. So.
I'm going off script here, but I'm curious, how often are neck conditions and shoulder conditions related?
Based on my experience, I would say probably a quarter of the patients I see have both neck and shoulder. So I'm always evaluating both.
Okay.
And there's a lot of overlap between the two. So a pinched nerve in the neck can cause pain going from the neck down to the shoulder, even down to the hand. And part of my evaluation is trying to differentiate between the two. But sometimes even that's not entirely clear.
Right.
So it is quite common, and it's also common for a problem in the shoulder itself to sort of spread from there. I think people get muscle pain, or what we call myofascial pain,
right,
from altered posture,
right,
around the shoulder. Particularly, I think when people have had chronic shoulder problems, like pain for a year, pain for 2 years, now they really have changed the way their muscles are holding the shoulder blade around the shoulder, and because of that, they can get pain around the inside of the shoulder blade, or going up the trapezius, going up to the neck. So there is definitely a lot of overlap between the two.
Got it. So let me see if I can summarize. Shoulder pain is quite common.
Yes.
More common as we age.
Yes.
Certain vocations and repetitive movements make it more prevalent. Certain lifestyle choices will make it more prevalent, that are preventable. By the way, I'm going to repeat that. Obesity and smoking, all of those things you can prevent.
Absolutely.
And prevent.
Not saying it's easy.
Correct. Nothing.
But it is achievable.
Exactly. It is good to maintain full range of motion in the shoulder. It's good to maintain appropriate strength, balanced strength of the scapula and the back and all the posture muscles.
Yes.
So not just your power muscles.
Exactly.
Somebody said the show muscles, the look good muscles.
That's right. Yeah.
We've got to work on the muscles under those too. And then coming to see a shoulder specialist when they have any of the red flags that we talked about.
Yeah, absolutely.
And then maintaining good bone health.
Yes. Yeah, the bone health aside, I'm glad we talked about that. It's something that is more and more common in society, and something that, as orthopedic surgeons in general, of course, not just shoulder specialists, right, but something that I think that we can just educate people about. And
right.
It'd be so helpful on a societal level, for us to just maintain better bone health and prevent a lot of these fractures that happen when we're older.
And same with obesity and diabetes and smoking as well.
Absolutely.
We could prevent a lot of things.
Absolutely.
We'll have to have another conversation about that.
Okay.
And if anybody wants to make an appointment with you, they call Houston Clinic, and you clinic in downtown Nashville and South Nashville.
Yes. I have a clinic at Centennial Medical Center in downtown Nashville, and then in South Nashville at our Harding Place location. That's you're at the corner, essentially, of Nolensville Pike and Harding Place. So, please come to see me if you have any concerns. I'd be happy to see anyone anytime.
And he's fantastic. He answers your questions. He explains things wonderfully. I'm very thankful that I get to work with you.
Yeah,
so thank you so much for your time.
It's been a pleasure. Thank you.
Thank you.